We want to move ahead, right, to the next section, which is on novel interventions for teachers and peers in schools for children with ASD. We've got three speakers in a row. First will be Ya-Chih Chang, who is here from Cal State LA, and she'll be speaking on teacher-implemented intervention for preschool children with autism, engagement and play. And then can I assume you'll introduce the next speaker or I can come this I can do it. Okay. All right. So thank you, and welcome our new speaker. Thank you so much.
Thank you. So I'll be presenting on teacher-implemented evidence-based joint attention for preschool children with autism today. So you'll see some clips of really cute kids, so I'll wake you up a little bit after lunch, hopefully. So why are we targeting joint engagement and joint attention? So we know joint engagement provides a really rich context for social interaction and social communication for our kids. And we also know from research that joint attention is a core deficit in children with autism. And we know that children who have more joint attention when they're younger, they're gonna have better language outcome later on. So that's why we're really targeting these skills for early intervention. And just to start my talk, I want to show you what it looks like in a typically developing child who is about 17 months old, as well as a child who has autism that's around the same age but 24 months old. All right, and here's a clip of a child with autism. So you probably noticed the qualitative difference between these two kids. The typically developing child is using a lot more joint attention, that really nice eye contact, gesturing, and then positive affect, right? And also responding to the adult who's during that interaction, versus our child are delayed in these areas. So in talking about joint attention intervention, there are a lot of peer-reviewed, high-quality joint attention intervention out there. However, most of these studies have been conducted in clinical settings and one-on-one with a very trained interventionist. And today, there's only 3 interventions out there that's really teacher-implemented. So today for my talk, I want to talk about a teacher-implemented joint attention intervention and how we modified one of our evidence-based joint attention intervention to actually translate it into the preschool setting. And the joint attention intervention that I'll be talking about today is called Joint Attention, Symbolic Play, Engagement, and Regulation. It's actually an intervention that's developed by Dr. Connie Kazri here at UCLA. And just to talk about how we even approach in developing this intervention. So we use a community partner participatory approach, and you'll hear more about this in detail with Dr. Goldswell and Carr and Loretta Jones later on. But basically, we invited all these community stakeholders and had them actively involved in the development of this project. We provided in-service talking about evidence-based practices for children with autism, but we also have focus group asking them what they want to see in a preschool setting, what do they want to learn, and how do they think it's going to be feasible for us to actually implement these evidence-based practices in a real-life school setting. So after having these conversations with our community stakeholders, we have 3 goals in mind. We wanted to improve joint engagement, social communication, and play like we do in clinical settings. But at the same time, we really wanted to focus on that feasibility and sustainability for these interventions in the school settings. So we were able to recruit 66 preschool children for the study, and all of them confirmed their diagnosis on the ADOS. and their average age was about 4 years old. And we had a range of kids who were involved in this study. We had kids who were mainly verbal, who didn't have any language at all, to kids who were using complex sentences because they were preschool. And we also had a very diverse sample of kids in our study as well. As for the teachers who participated in the study, they were recruited from 6 different preschools around the LA area, and we actually had 1 head teacher and 1 paraprofessional from each of these preschools to be trained in this intervention. So after talking to our community stakeholders, what we found is they're excited about learning evidence-based practices, and they really want to implement it in the schools. So when we're thinking about designing our study, we decided to use immediate treatment and waitlist design so that at the very end of the project, everybody who's involved in the project was trained. So the intervention itself was 8 weeks long, and then we had a 1-month follow-up as well. So training model, so this is important. Thinking about those 3 studies that I talked about earlier, we use some of the strategies that they use in training these teachers. But the first phase of the training models is using 2 30-minute prep sessions with these teachers. Because we know once we're in the classrooms, during instructional time, there's not gonna be a lot of time to coach them through these strategies, right? So in the first training prep session, we use PowerPoints to really go over those basic strategies that we really want them to pick up. And also the second planning session, we had what we call intervention planning. We assess all the kids, and we basically group these kids based on their developmental level that's going to be appropriate in the classroom. And we also talked about what they can use that's already pre-existed in their classroom, the toys, because once us as researchers pull out, we want them to sustain it, so being able to use the materials they have in their classrooms. And then second phase of the intervention is really the crux of our intervention, that in vivo coaching session with the teachers and the paraprofessionals. So again, the intervention was 8 weeks long, and the coaching session, we actually used their 15-minute rotation in these preschools during their play sessions to do the coaching. So it's very naturalistic. They already have a play center, so it's really easy for us to embed of our strategies in there. And what we used was what we call a consultation model. So we were there with the teachers and paraprofessional pretty much 5 days a week at the beginning of our intervention to really target those strategies with the teachers. And as the 8 weeks, we faded out our support because the teachers, they were learning these strategies, right? So we faded out our support, so by the end of the 8 weeks, we are there 1 to 2 times a week. So in terms of the child measures, so again, today I'm really just presenting the joint engagement, the joint attention data, but then how do we measure this? So in terms of measurement, again, we wanted to measure it in a very naturalistic setting, so we videotaped them when they were playing with their kids in that play center that existed in their classroom already. And what we coded from these play centers was the duration of joint engagement. How long would they jointly engage? So being able to respond to their peers and teachers using joint attention, that really nice affect that you saw earlier on in the clip. And also the number or frequency of a spontaneous initiation of joint attention skills. So what did we find, right? This is the exciting part. In terms of joint engagement, at the beginning, our studies for both our kids, both the waitlist and the immediate treatment group, they were spending about 20% of time joining engaged. Our treatment group, they increased that joint engagement to 50% of the time, and this was significantly different from our waitlist group. And what is so wonderful about this, they were able to sustain it at that 1-month follow-up. And in terms of the initiation of joint attention, the kids were using about 10 different joint attention skills within that 10-minute video clip at entry, but at exit, they increased it on average to about 15, and at follow-up, this is even more exciting, than increase the gains of their joint attention. So remember, we want the kids to be using more joint attention because we know from research, kids who use more joint attention skills, they're gonna have better language outcome later on. And these are spontaneous, so it's not prompted joint attention skills. So talking about data, this is really hard to conceptualize it, right? So I wanted to show you guys what it looked like in terms of joint engagement and also use of joint attention from before we started intervention as well as what we did towards the end of the intervention. So what I want you guys to really focus on is the child in the first clip, the child in black, and it's going to be the same child in yellow for the second clip. So you probably noticed the child is very object focused on the toy he has in his hand. So now we're going to watch another session that's towards the end of their intervention. He's trying. So you see there is a very qualitative difference between the pre and the post of intervention. He's using a lot more language. He's like using eye contact and that social interaction with his peers, right? And of course, you'll probably notice that the adult in the clip also changed the way she was interacting with the kids as well. I'm not going to talk too much about the adult data today, but I wanted you guys to notice their behavior was changing during their intervention. So in conclusion, our teachers as well as our paraprofessionals who were trained, they're great intervention agents for the intervention. They're so enthusiastic. 8 weeks is a very short but targeted intervention, and they were able to pick up these strategies. Really wonderful individuals to work with. And then what is so nice about it is they're the one who's working with the kids in and out, day in, day out, and they're able to change that joint engagement in their classroom with their kids, as well increase that joint attention skills. And what is so nice about it, at that 1 month follow-up, we were able to see that they were able to sustain their skills. Even though we can see from this work we sharing with you guys today, that the teachers are able to embed these strategies and make these gains, that we definitely need a lot more evidence-based practices in the schools. Just from research, we know it actually takes 17 years to bridge that research into evidence-based practices into the community setting. So we have a lot of work ahead of us, but it's fantastic and rewarding. And lastly, I just want to thank all the kids and families who participated in our study, as well as our community stakeholders, partners, teachers, paraprofessionals, who were so willing to participate and enthusiastic, and of course, everybody at the Casri Lab who worked so hard on the project and our funding agency, Autism Speaks. And that's it.